Hello, I'm Dr. Dushyant Purmanan from Mauritius. I'm a pathologist working in the Central Health Laboratory there. It's in the public sector. We do everything there: histopathology, hematology, cytopathology, and transfusion medicine, where we are in the diagnostics of patients' tumors and benign conditions. In Mauritius, we have around 15 to 20 specialists in oncology department. Some are specialized in medical oncology, and majority are both radiation and medical oncologists. We have one centralized department which is in the center of the island at Victoria Hospital, having both radiation department and medical oncology department. And then we have 5 regional hospitals where we are dispensing medical oncology services, mostly chemotherapy. Unfortunately, it's a very old department, and nowadays with the increase in number of oncology patients, cancer patients, the department has become crowded and cramped. So hopefully in a few years, we are coming up with a new cancer hospital which will cater for both medical and surgical oncology, and which will be a relief to the cancer patients nowadays in Mauritius. Other key challenges that are there in this oncology department and the management of patients is the availability of new drugs. Very often in government setup, we don't have access to new drugs due to budget constraints, because healthcare system in Mauritius is a fully free system, Mauritius being a welfare state. Very often our specialists in oncology are not updated regularly about the latest and novel technologies and latest drugs available in the market. So very often our patients tend to be treated with previous older generations of drugs when we have latest drugs available which can prolong their life, their survival rate, and offer them a better quality of life. As a pathologist, our main role is in the diagnosis of patients. We diagnose cancer in many patients. I am here for special training in hematology, more specifically in flow cytometry, where we go for immunophenotyping. Immunophenotyping is very important in the diagnosis of hematological malignancies, that is leukemias and lymphomas, which affect both children and adults. For me, this training is very important right now because this flow cytometry is being started soon in Mauritius, and I will be there to start the department and to see how we are going to proceed further, because immunophenotyping is a diagnostic test which will help our clinicians in providing a better management, a better treatment, especially with the advent of targeted chemotherapy. Our patients will be benefiting from these services. We'll be providing our clinicians with a proper and correct diagnosis, which will assist them in giving the proper drugs regimen to the cancer patients. I am here for a 6 weeks training in the hematopathology laboratory at ACTREC TMH. During these 6 weeks, I have learned many things about the flow cytometry. From the start, how the samples are treated, how the samples are processed, how the samples are tested in the machine, and then how we as pathologists, we analyze and issue a report about the different tests that are done. Merck Foundation is doing a wonderful job by providing this platform that is allowing doctors to get training in prestigious institutes like Tata Memorial Hospital. It is a sea of knowledge, and we should come here with a mind like a sponge just to absorb whatever is possible in terms of knowledge, experience. because what we will gain here, what we'll acquire here in terms of volume of patients, volume of tests, whatever is there in our textbook, we see it in reality live here in this hospital. So my advice to new doctors who will be joining this course for training is to just come and learn. Just have an open mind and be like a sponge, just absorb whatever you can absorb. India is a beautiful country, make the most of it. I wish to thank heartfully Merck Foundation for sponsoring my short training course here in Tata Memorial Hospital, more specifically ACTREC, the hematopathology lab in Kharghar. A special thanks to the whole Merck Foundation team who have helped us, supported us throughout our course, throughout our stay, taking care of our troubles, preventing any accidents to happen to us. We are in safe hands and we were guided through these days by Vishaka and Venu. They did a wonderful job and I wish to thank them personally. Also, I wish to thank the team of a hematopathology laboratory in ACTREC. My special thanks to Dr. Subramaniam, the officer in charge of the hematopathology lab, Dr. Nikhil, Dr. Prashant, Dr. Gujral, and all the technologist team who have assisted me and helped me. There are so many of them, I won't be able to mention all the names, but my stay here was short, but I'm leaving with lots of new friends and lots of new experience.